Good morning, everyone, and welcome to our training on the CQC requirements for infection and prevention control in the laundry area of your residential home. Today, we're going to be looking at the practical elements that managers and frontline staff can do in order to achieve all of these requirements. The presentation should take no longer than about 30 minutes, and we'll be happy to take any questions that you may have at the end of this session. As Lee said, we've got plenty of time for questions throughout the session and at the end as well. To give you an overview of what we're going to be covering in today's session, we'll look at the following items. So we're going to look at the guidance for effective infection control, the requirements set out by the CQC, and also an effective laundry process as well. Crucially, at the end, we're going to look at the difference between commercial and domestic washing machines and how many people incorrectly make the assumption that they are all effectively the same. Commercial washing machines are a far superior product than their domestic counterparts, but we're going to go into the detail and explain why throughout today's training. I would, though, like to hand over now to Barend Tahar from BES Healthcare, who is going to talk to you about the basics of infection prevention in the care home environment.
Good morning. Barend Tahar, BES Healthcare. I was originally a biochemist. I've been involved in this area for over 30 years. But today I'm really here to give some of the background behind the infection prevention that we talk about these days. And I remember not that many years ago, we used to call it infection control. But by the time you've got an infection and you're having to control it, it's a little bit too late. So what we're trying to do is talk about preventing it. And this is just a little bit of revision. Most of you on this call will know all about it, but just for setting the scene. When we talk about infections, we talk about infectious bugs, and the infectious bugs are ones that get spread in the air, and you pick those up by breathing them in. And those are rather different from what we call a contagious bugs. The contagious ones comes from the same word as contact, and they come from physical contacts. And they can get spread by being deposited from your hands or from your clothing onto the things you're touching. They also can arrive from the infectious bugs that are in the air, condensing out of the air and landing onto a surface. And these can then be picked up from touching the surface. So we then are concerned about these. The infectious bugs we breathe in. The contagious ones get into the body through breaks in the skin, through touching the nose, the mouth, and so forth. So generally, when we're looking at infection prevention, we've got to protect ourselves and people around us from both the infectious side of things and the contagious side of things. So how can we control these sources? Well, we've had a lot in recent months around COVID. So I think people's awareness of prevention has really gone up a heck of a lot in the last 18 months. So when we're dealing with infectious agents, we can control themselves by protecting ourselves and others around us by wearing masks, face shields, etc. And that's common everyday life these days for us. When the bugs are in the air, we can work on them by removing them by air purification and by ventilation. We're now encouraged these days to have windows wide open and the air blowing the bugs out into the surrounding area and away from us. Whereas with the contagious agents, we have to take a different approach. We protect ourselves by wearing gloves and aprons so that we don't get the bugs onto ourselves. But we shouldn't really forget that this doesn't stop us from spreading what has gone onto the gloves to other people as we touch other things around. So we have to be aware of both not just protecting ourselves, but protecting other people. And these bugs, the contagious ones, are removed by cleaning. And ultimately, we destroy the bugs that are left after we cleaned by what we call disinfection processes. So very briefly, let's look at what we call walking the minefield of unknown bugs. And the problem is that bugs are invisible. And so should we be assuming that everything around us is contaminated? If we did that, I guess we'd never go anywhere. But it is something to think about, is that you're never quite sure whether something you've touched has actually brought a bug into your environment or not. So along this line, prevention is better than cure. So let's see what we can do to stop them before they get to you. And that's really the principles behind the vaccination programs we're getting there, is that the bug gets into you, it gets knocked out before it starts spreading in your system. But also we need to bear in mind that cleaning is not disinfection. When we wash something down, we are washing away a lot of the bugs, but there are always some left. And cleaning in the normal nomenclature that we work in is saying that something is visually clean. But the problem is the bugs are still invisible. So where are they? So we've got to bear in mind that although we can't see them, there may still be some left after we wash something down. So we rarely go forward to disinfection. Disinfection is not cleaning. Cleaning is taking things away. Disinfection is killing the bugs that are left. So we do try to separate those two concepts from each other. Another important thing is that bacteria do need moisture to grow. So once you've cleaned something down, disinfected it, it is important it's kept dry afterwards. So any bugs that are left haven't got the moisture they need to grow. So as we say, drying after cleaning and disinfection is critical. Otherwise, the bugs can start growing again. So that's a little bit of a background to what we're doing today. And I'll pass back to Sam now, who's going to move into the linen area. And I'll be back later to talk about things that can't go through the laundry. Over to you, Sam.
Thank you for that, Barend. When you think about laundry, we need to look at the processes in your care home, and we actually need to look at the definition of linen, because the list is far greater and more diverse than people might initially think. Linen refers to anything in the home that is made of fabric that you might need to remove and wash at any point. And this can include things such as curtains, removable furniture covers, as well as the more obvious clothing items, towels, tablecloths. The social care environment presents some significant challenges as far as the care of linen is concerned. There are different types of linen that need to be laundered, from clothing to bedding, soft furnishings to toweling. And there are really different levels of soiling that you're going to have to deal with. So it could be simply dirty, lightly soiled. It could be heavily soiled, or it could be infectious. And there's the volume of laundry to consider, as well as the frequency. You know, at home we would normally only wash perhaps a few times a week, but in a social care environment, the laundry room will often be operating all day, every day. In addition to these considerations, you're also required to adhere to the CQC requirements, whilst operating against a backdrop of potentially high turnover of staff and the need to provide the mandatory infection control training as well. Handling personal linen should be done in a sensitive way, taking into account the needs of the individual. There are there could be some residents who require particular washing powders to be used due to allergies, or others potentially might be sensitive about the way their clothing is handled due to religion or gender. So care should be taken that the linen used in the home should be, material that's fit for purpose for which it's intended. The linen both looks clean and is clean, and that the linen is not damaged or is not discoloured either. There are essential quality requirements for linen processing that need to be observed by all residential homes. The first is to have an effective policy that staff can refer to easily or can be easily digested and remembered. An effective policy should become part of the company ethos and reflected in everyday working practices. Policies will need to take into account regular observation of the condition of the washing machine, correct operation of the washing machine according to the manufacturer's instructions, and also the correct use of detergents. Your policy should be in line with your other home policies. Potentially, you've got waste reduction policies and sustainability targets as well. Staff should receive training on how to use the equipment correctly, so problems such as overloading or incorrectly dosing the washing don't occur. It's also important to ensure that your staff are always protected and adhering to all policies around PPE, which, as we know at the moment, is particularly vital. In the laundry area, there are some essential requirements that all homes should follow. PPE should be worn by staff doing the laundry at all times, including the use of single-use aprons and gloves that should be disposed of appropriately. And once the linen is clean, it should be stored off the floor and not kept in the laundry room, but in a separate clean area. Design of the laundry area is crucial when it comes to reducing the risk of recontamination of clean laundry, and also crucial in protecting staff. To help your organisation achieve the highest CQC rating for your infection prevention and control capabilities, our best practice recommends the use of commercial grade washing machine over a domestic washing machine. The reasons for this is because of the better build quality and warranties, and crucially the additional disinfection programs on professional machines. If you're considering a commercial machine, then make sure it's RAS approved and you have it professionally installed and maintained in order to get the very best from your investment. The disinfection stage of the wash should be validated annually to ensure that it's effective in helping fight infections. Handling dirty linen is one of the most problematic stages of the process, putting staff at risk unless the right protective clothing is worn. When removing bed linen from a resident's bed, it should be placed directly into the appropriate container and not placed on the floor. And the same is applicable for personal clothing as well. Neither soiled nor infectious linen should be held next to the body, as this could increase the risk of contamination of the uniform. And segregation of the linen should be done as it is removed rather than segregating it in the laundry area. This is to help prevent any potential spread of infection whilst in transit. After handling the linen, staff should remove PPE, dispose of it correctly, and then wash their hands using antibacterial hand wash. It is the responsibility of the person handling the linen to ensure that it is segregated properly. There are two different processes that can be used here. In the standard process, white or off-white bags are used. Soiled or infectious items should be placed into a water-soluble bag and placed into a white impermeable bag. Heavily soiled items should have any solids removed before being placed into that bag. In the enhanced process, red bags are used. These bags are water-soluble and should be placed inside an impermeable bag for transport to the laundry. And these bags need to carry bold lettering stating infectious linen. In the standard washing process, most microorganisms will be removed by the detergent and water during the standard washing cycle of the machine. Items should be washed at the highest suitable temperature according to the care label. And a good quality commercial machine will have programs available specifically for certain wash types, which will make this much easier for you. Sometimes, though, a standard process is not enough to protect you and your staff. When certain triggers take place in the residential home, it's important to introduce an enhanced process for the laundry. Triggers could include unexplained diarrhea and vomiting, for example, norovirus, which is therefore highly contagious, a confirmed infection or contagious disease. You might get unexplained rashes in the care home with some of the residents, or confirmed cases of conditions such as scabies or lice. Unexplained fevers, again, can be symptoms of a flu going around the care home. An enhanced laundry process means that the wash should be performed at the minimum temperature of 60 degrees. And the next slide will go into more detail on exactly what this means. A good quality commercial washing machine will enable you to achieve this process simply without the need for additional measures to take place. It's vital that this information is adhered to in order to protect both staff and residents from the rapid spread of infection. Conditions such as norovirus can really shut down a residential home or close the doors of it overnight. There are some very basic do's and don'ts of laundry when it comes to enhanced processes. So never open the inner water-soluble bags, the red bag, as this allows the infection to spill out out unseen from the inside of the bag. You never want to overload the washing machine, as this could mean that the wash isn't effective. And heavily soiled items should have a pre-wash or sluice cycle before going through the normal wash cycle. As managers in care homes and owners, there's a variety of responsibilities when it comes to ensuring the safety of your staff and your residents. So ensuring the knowledge of the staff is of the appropriate level. It's important to refresh that knowledge regularly. We recommend annually. Provision of appropriate laundry equipment according to the needs of the residents, and the supply of single-use PPE to all staff involved in the day-to-day operation of the residential home. The care staff have their own individual responsibilities of a number of key parts of the process. It's their responsibility to wear single-use PPE at all times, to employ regular and appropriate hand washing techniques. Staff in the laundry area should have a good knowledge of the different requirements of bagging and handling different levels of dirty or soiled or infectious linen. And staff operating the laundry equipment should have knowledge of how it works, what settings to use, and what are the best settings for soiled and infectious linen. When it comes to selecting the right equipment to use, how do you make the choice between commercial and domestic equipment? It might seem easy to pick a domestic machine that's potentially cheaper to use in the residential home, but there are a couple of really big considerations you need to think about. You need to look at how often the machine will be used compared to a normal domestic machine. So the durability, including the impact this might have on domestic warranties. Generally, a domestic machine will only ever have a 3-month warranty or potentially no warranty at all in a commercial environment. And also you need to look at the need for the sluice cycle or infection control measures in the machines. Again, standard domestic machines don't offer thermal disinfection or sluice programs. The other big advantage of having a commercial machine is the testing it undergoes, the maintenance plan it comes with, and the 24/7 availability of engineers in the unlikely case of equipment failure. Most care homes, as you know, couldn't survive without their washing machine, so it's vital the equipment is reliable and regularly maintained. This takes care of all the washable items, but what do you do with things that can't be put into the washing machine? Barend is now going to take you through that.
Thanks, Sam. The principles that you've gone through of best practice really do emphasize the professionalism that comes from Miele and the background of having a properly resourced commercial laundry set up within your own establishment, which is great. However, not everything can go into a commercial washing machine. So this is really the next short session we're going to cover is the items that you have around the home that cannot be laundered. And we'll be covering here things like, there tend to be textiles, things like curtains, they could be armchairs, they could be carpets, etc. but also there's other units around the home, such as mattresses. And there is a very useful document for a free download from the British Healthcare Trades Association, which is called Protect, Rinse and Dry. And that really emphasizes the challenges of looking after your mattresses and their coverings so that you don't get anything permeating through the cover into the inner foam or whatever the mattress is made of. Now, this is quite an important area. And the challenges are with really what kind of chemicals can you use to disinfect these, because the tendency over the years has been to use chlorine, but the research that goes on these days shows that chlorine really does damage the material of the covering of the mattress, and very quickly it becomes permeable to things you don't want getting through to the foam. So considering what you use to disinfect them is really important, and that's an area where British BS Healthcare can come in and advise you. And there are other solid items around the place, such as bedside lockers, wheelchairs, commodes, walking frames, etc. And these are things, again, that obviously can't go through the washing machine. There are ways of putting these through an automated washing machine, which are designed for larger items like this, or they can be treated externally. We'll come back to that in a moment. And the other area to be considered, of course, are the fixtures and fittings around the house, around the building. And these can be light switches, they can be railings and so forth, and how are these covered? And another area that will be in many homes, there will be medical devices. And these can be wheelchairs, they can be walking frames, they can be rise recliner chairs. And medical devices actually have legal requirements that they need to be cleaned in certain ways, but also have to be disinfected with CE marked disinfectants, or else if you're using thermal disinfection, you have to use a CE marked piece of equipment. And that's a bit more complicated, and that's the area where BS Healthcare can give advice if necessary. So heat, as we've heard from Sam, can be a good way, is a good way of killing bugs, but not everything will accept heat. So we have to use a disinfectant instead. And actually, not all disinfectants are the same. The target organisms that different disinfectants are designed for vary. So some are designed for bacteria, some for mycobacteria, which is what's is behind TB, for example. Some are very good at handling funguses, and some are very good at handling viruses. And the requirements that the NHS puts out for your alcohol sanitizers are really looking at bacterial killers of those sanitizers, and it doesn't really look at the viral kills, and we're all using them these days to protect us against COVID. And there are different criteria in the testing standards for these different chemicals, depending on what you're trying to kill. And there's also different disinfectants for liquid versus surfaces. So inside a washing machine, you are looking at liquid disinfection because the disinfectant is mixed in with the water. Whereas when you are looking at disinfecting a hard surface, you've got a different approach from when you're dealing with textiles. Textiles will absorb the disinfectant into the material and keep working a bit longer. Whereas on the solid surfaces, they can be wiped off. So one has to remember that for the disinfectant to work, they have to be attacking the bugs for a certain time, what we call a dwell time, before you take them away. So spraying the disinfectant on and wiping it straight off doesn't give it long enough to kill. You have to go by the instructions as how long the disinfectant should be on something before it should be dried off. So that has to be brought into consideration as well. And then we've got the situation, as I was discussing a moment ago, of dealing with domestic equipment in the home as compared with the medical equipment in the home. And as I mentioned a moment ago, the UK medical device regulations specify the medical devices have to be disinfected with medically CE marked class 2A disinfectants. So it gets all a bit complicated, but we're again, BS Healthcare is there to help out if you want some help in that area. So the big picture is that we can offer advice as to where prevention comes in, and it's everyone that's responsible for it everywhere around the building. So we talked about linen and laundry and best practice in the laundry area and handling the laundry, but there's also best practice to be carried out throughout the building. And one of the advantages of sometimes getting an external auditor to come in and have a look at what's going on is that people who are coming from outside see things are fresh, whereas when you live with it every day, you don't notice it. And my wife would say that with the dust that arrives around the place, I don't notice it because it's there all the time. But then I will be reminded that why didn't you go and clear that dust that you just noticed? So when you live with it, you don't notice it, but somebody from outside can. So basically, what we're offering here today is that BS Healthcare have experts in infection prevention, and we do offer free audits to homes to give best advice. So that's the background to general principles, and we're now moving on to a short session where we look at some of the products that are available. And before I pass over to Claire, BS does have advice on certain infection prevention solutions. We can advise where you can get washers for equipment, from small things like commodes and so forth, up to mattress washers. There's portable disinfection equipment I'll come back to in a moment. There's air filtration systems. So all the different ways of handling both the infectious bugs and the contagious bugs, we can give advice as to what kinds of best equipment could be available. And for example, in the picture here, this product that's made in Italy called the Hygienio, and that applies through a spray a disinfectant that is class 2A that's required for medical devices. There's a wheelchair here, but it's very effective too for spraying curtains, soft furnishings, and everything else in that area. So again, come to BS Healthcare, we can give you the best advice in generally around the home, and for specific areas, back to Miele and dealing with the laundry equipment.
Thank you, Berend. So I'm just going to take you through some of the product solutions that Miele can offer you for your care home environment. So Miele's Little Giant range of machines are the perfect space-saving solution and can be stacked in order to fit in an area less than 1 meter squared. They come preloaded with a suite of programs to suit your customer needs, which includes all the hygiene programs designed specifically to meet the guidelines laid out in the Health Technical Memorandum. All of our machines are tested for 30,000 hours, which equates to approximately 12 to 15 years of continuous use. That's 8 hours a day, 7 days a week. You can choose between either a drain pump or a dump valve gravity drain machine to ensure that no blockages occur when using sluice programs. Our cycle times are short, which enable you to process up to 76 kilos of laundry in an 8-hour day in either a 7 or an 8 kilogram capacity machine. These machines can be connected to dispensing systems, which enables consistency of dosing chemicals in every wash and ensures the best washing results. Our current range of machines launched last summer, and we have managed to redevelop them to operate using up to 28% less energy and consume 22% less water than our previous models. At Miele, we pride ourselves on sustainability, and we always use high quality materials when manufacturing our machines. For example, we use stainless steel instead of plastic. The result of this is that 96% of our products can be recycled at the end of their life. Our Little Giant range of machines have a 7 to 8 kilogram capacity and can wash and dry a full load in just 85 minutes. If you compare this to a typical domestic appliance, which would process the same load, but in approximately 210 minutes, it's clear to see the benefit. You would be able to wash and dry approximately 2.5 times more laundry in a commercial machine in the same amount of time as in a domestic. Plus, it also complies with the regulations. This is also important as it helps to reduce the amount of soiled laundry waiting to be processed and cuts the risk of infection spreading. Our benchmark range of machines cater for the increased load sizes from 11 to 18 kilograms, enabling you to process larger loads of bedding, etc. They also come preloaded with a full suite of program packages consisting of up to 200 programs. And on installation, our engineer can tailor the programs to suit your needs so that your favorite programs will always appear at the front of the program list, which enables quick and easy operation. These machines still offer quick cycle times, even with the increased load sizes, and can also be connected to dispensing systems. We have developed the suspension system to ensure there is less vibration produced from the machines when using the highest spin speeds. This results in a much quieter laundry operation and less disturbance to staff and residents on site. We also offer a range of barrier washers from 16 up to 32 kilo capacity. These are a great solution which enables you to separate your unclean and clean laundry and minimize any risk of cross-contamination of the laundry. Here, when the picture comes up, you can see an example of a laundry setup which involves separating the dirty and clean sides of the laundry handling. In this example, you can clearly see that the in-feed and out-feed sides of the washing machine are separated. This is because a barrier washing machine is being used, which has a double-sided door, allowing dirty laundry to be put in one side and clean laundry to be taken out the other side, as the arrow shows. So in addition to washing, we also offer a full range of ironers. We have a professional steam ironing system, a portable 1 meter rotary iron with or without a steam function, and we also offer a range of larger flatwork ironers. And in addition to our range of laundry equipment, we also offer dishwashing solutions. Our hygiene dishwasher has a range of standard programs for your everyday needs, but also includes hygiene programs with high final rinse temperatures and the correct holding times. As with all our laundry range, our dishwashers are also RAS approved Category 5 certification. Miele Air Control is our first mobile air purifier to contain the spread of infection, and we are privileged to be one of the first countries to launch it, and it actually launched this week. Air Control was created in response to the pandemic and is the fastest concept to production product to hit the market in Miele's history. With both hygiene and quality in mind, the Miele Air Control has been designed to prevent the spread of infection through airborne particles and will increasingly play an important role beyond the pandemic. As indoor spaces imminently reopen across the country, Miele Air Control can be used alongside other measures to create a hygienic environment across a range of businesses, helping to keep staff and residents safe. And in addition to our full range of products, at Miele, we also pride ourselves on our service offering and after-sales support. Not only do our products come with a full 1-year parts and labour warranty, which is extendable, but we also offer a range of preventative maintenance service contracts to ensure your laundry and dishwashing products are always delivering the best results. We have a network of over 200 engineers offering the same day, next day call out service. And as you can see on this slide, our first time fix rate is very high at 96%.